that you're doing well. This is Know Your Health. My name is Sylvia Nyongesa. I'm your host. And the last part of this show, we were talking about breastfeeding, but we are continuing on the part 2 of the same, because last time we were just talking about what is breastfeeding, how can you do it correctly, what will you eat so that you can get enough breast milk for your child, and the benefits of breastfeeding. But in this segment today, we are just talking about the emerging issues that have arose from the issue of breastfeeding. And we've just been talking about breastfeeding. But again, we've seen that with the coming of technology and all these other things, and even young girls getting pregnant, but they do not want to look bad. So they don't want to breastfeed their child. They opt for using maybe formula. Or maybe they just do not have time to breastfeed.
Thank you. About breastfeeding and looking nice. Let's not be cheated. Aging is a natural thing.
Yes.
Whether you breastfeed or you do not breastfeed, you will age. There are some girls fear the breast will sag.
Yes.
But even without breastfeeding, at one point they will sag. So the good just breastfeed your child and put on the right clothing, you look nice. So girls don't fear breastfeeding. You will be at a more advantage. If you don't breastfeed, then you will make frequent visits to the hospital because you are not doing the right thing. Those who opt for formula milk, they are not doing the right thing. In fact, the formula milk has so much in the supermarket that you wonder who uses them. If you're in a position to breastfeed, God has given you the breast, please give the child the right to that food that you are carrying, that God gave you free. So give it to the child. It has so many benefits compared to the formula milk. Those children who feed other things other than breast milk, you can be assured that they don't have the immune boosting capacity. The breast milk has such ability to boost the immunity of the child. These other milks, they don't have. The animal milk is not meant for the child. It is not in the right proportion for the child. So the best milk is mother's milk for that child. Don't deny the child that good thing that you are carrying. You just give for 2 years and you go back to your shed. Yes.
Okay, and is there a condition that maybe a mother might have that might bar that mother from actually breastfeeding the child, and therefore maybe the health expert would recommend for her to use formula?
Yes, there are conditions that the child completely may not be able to breastfeed. For example, we have women who develop something called periopsychosis.
Yes.
Women after delivery, a few percentage, they get some mental problems. And tunasema wanakuwa ni kama wazimu. Some even refuse to see their children. They even wish to kill the child. You try to bring the child close to the mother, she cannot breastfeed. So in that case, where the mother cannot completely breastfeed because of her mental condition, then you can opt for the formula milk because there is no option. In that case, you don't have any access to mother's milk. We also have a situation where the women may go into a coma. She cannot be able to breastfeed. Or even there are situations where the mother might pass on. The mother sometimes die. In that case, you have no option other than to give the formula. So that is the only option that you can go to that extent. Currently, we have the issues of COVID-19.
Yes.
That one does not stop you from breastfeeding. Whether you are a suspected case of COVID-19 or you have been taken samples and you've turned positive for COVID-19, the recommendation from the Ministry of Health is that continue breastfeeding your child as recommended by the Ministry of Health, starting with that early initiation of breastfeeding, exclusive breastfeeding up to 6 months, and also continue breastfeeding up to 2 years and beyond, giving appropriate complementary feeding, or we are talking of balanced diet. Now for COVID-19 cases, those who have been tested to turn positive, we are saying you can still breastfeed your child. But in this case, you follow the COVID-19 protocols. When you're breastfeeding and you're COVID-19 positive, you have to have your mask on when you're breastfeeding so that you don't infect your child using those salivary droplets or coughing. So you have to breastfeed when you're putting your mask, and in this case, if you're COVID positive, it's even recommended you can use the N95 mask so that you can prevent your child from getting positive. Also, you encourage to practice a lot of hand hygiene while you're handling your child, because probably when you've touched your mouth or you've touched your nose, so you could be having those viruses on your hand. So you encourage, before you breastfeed your child, wash your hands, have your mask on, and then you can breastfeed your child. And in this case, we are talking about COVID-19 positive cases, not any other person. Unless that mother is in a very critical condition where she cannot be able to breastfeed. Otherwise, in normal circumstances, being COVID-19 positive does not mean you cannot breastfeed. You can still breastfeed the child. Yes.
You've said that breast milk is the first choice, but there's these people who opt for the formula, maybe because of medical conditions or other reasons. What can you say are the disadvantages or the effects of formula to the baby and the mother, or even their relationship?
Thank you so much. We have said that the formula does not have the immune booster, so they will miss that immunity part of the breast milk. Number two, for the formulas, remember you have to buy them, so they are costly. One tin will go for 1,000 and above, so it will really cost that family to have the formula milk. So again, those formula-fed babies, if they are not fed well, they are the children who become obese. You'll hardly get a breastfed child becoming obese. And these formula-fed babies, sometimes even in future, they also become obese and they develop other problems. So we are saying you only go for formula when there is no breast to breastfeed. But as long as the breast is there and the mother is okay, is alive, can breastfeed, let the mother breastfeed the child appropriately. There are so many benefits of breastfeeding that outweighs any other form of food to give to this child. So breastfeeding is the best for the child.
Okay, now that you've talked about COVID-19 and breastfeeding, maybe we can just go in there and talk about HIV as well, because we know that it also transmits through body fluids. So would you advise a mother, maybe who is HIV positive, to breastfeed, and how is she supposed to do it?
Being HIV positive, you can still breastfeed. However, we are encouraging women during their pregnancy to ensure that they go for ANC visit. ANC visit is you're visiting the clinic before you deliver, when you're pregnant. During that time, you'll have that chance to be tested for HIV. And don't fear, we don't test HIV to scare you. You are tested because we care about the baby. Once you turn to be positive, if you, by bad luck you're positive, it's not the end of everything. You are put into something called full heart. You're given HIV medications, and these HIV medications, they ensure that the child does not get the HIV while in the uterus. You also encourage to deliver in a health facility, so that the procedures by a skilled health delivery will ensure that the child does not get HIV during delivery. Again, we guide you through breastfeeding. You can still breastfeed your child even if you're HIV positive. However, you need to be very careful when you're breastfeeding, so that you can be taught how to position or hold the baby to the breast, and also you can be taught how the child can hold the breast so that you don't develop the cracked nipples. You know, if you develop cracked nipples, it means there will be some blood oozing, there will be blood coming out. and this increases the chances of the child getting HIV positive. You'll also be taught how to check on the baby's mouth, so that if the child, for example, has some oral tract, that time you go for medication, you don't breastfeed that time. So when you're HIV positive, you can still breastfeed like any other person who is not HIV positive, but now you need to be very careful so that you don't infect the child through breastfeeding. You need to be near a health worker so that you are guided appropriately, and also you continue the HIV medication so that the viral load, HIV virus, is brought down and you're not able to infect that child through breastfeeding. So a HIV positive mother can still breastfeed.
Still talking about these emerging issues that come with breastfeeding, we've heard of cases where mothers contract mastitis. What usually causes that when a mother is breastfeeding, or maybe after giving birth? What causes mastitis and what can be done?
We call them breast conditions that women develop during breastfeeding. And the cause of those breast conditions, like the engorgement, the mother's breast becomes very full and hot, and sometimes now it becomes infected. When you're talking of mastitis, it means that breast has got some infection. It means it got some wound, and this wound, some infections went inside. Sometimes you get some pus coming out, and in most cases, it is caused by the way the child holds the breast, the way the child is breastfeeding. And sometimes it is caused by the woman not draining the milk enough. The child is not breastfeeding well. So those are the things that cause the women breast conditions like mastitis and engorgement, and even those cracked nipples. The way the child is holding the breast, and also the way the mother is holding the baby, it can cause those breast problems.
Can we say it also has something to do with hygiene?
Yes, hygiene, but in most cases, it is the way the mother holds the baby to the breast, and also the way the child holds that breast. Vile anashika matiti ya kiume. Yeah, it causes some blocked duct, and also so you have retained milk that now infections enters in, and you have problems. But getting mastitis doesn't mean now you don't have breastfeed. You can breastfeed on the breast that is not infected, as you see the healthcare worker to work on the breast that has mastitis.
Okay, of course there are other medications that are not prescribed for a lactating mother and everything, but we'll talk about that when we come back from this short break. But thank you so much for watching. Keep sending in your questions, your feedback, your suggestions, and we will be here to read them and act on them.